Your mouth is the entry point for bacteria to enter the respiratory and digestive tracts, causing infections and inflammation that can wreak havoc on your body, causing multiple medical conditions. Yet, dental care is somehow seen as optional, and it's separate from medical care. Why? Well, unlike physicians who were gentlemen, dentists trace themselves to the barber surgeons who could lob off a limb and take out a tooth and, give you a nice fade at the same time. They eventually evolved in the 18th century to artisan dentists, and there is American patriot Paul Revere, who was an artisan dentist, and I imagine he brought those tools with him when he realized the British were coming. Later in the 19th century, these two guys, dentists, they became very scientific and realized there was definitely a connection between oral health and the rest of the body, so they went to the local medical school and said, well, can we put dentistry in the curriculum? And the faculty said, what are you talking about? We're gentlemen, you're butchers. And that's how dentistry was born in my hometown of Baltimore. And ever since then, this historic rebuff, it's a real thing, they actually call it that, dentistry has been separate from medicine. And it's very problematic. They have separate educational systems, separate professions. The dental office is very different from the office in your physician's office. And they have medical records that don't talk. But worse, they have separate health insurance systems. So health insurance will generally not cover dental care. And dental insurance, it's really not insurance. Instead, you have these annual limits where if something unexpected happens, you wind up going over the limit and paying out of pocket. And of course, people wind up just not having dental care because it's unaffordable. And in public insurance systems like Medicare and Medicaid, it's also considered optional. Except for children, it's not really required. And the result is, unfortunately, high cost for the system because prevention makes sense. So in this slide, you see the variation in Medicaid for adults. Tennessee is one of only 3 states that doesn't provide any kind of dental services for adults on Medicaid. Pregnant women and disabled people. So what happens is that people invariably wait until the last minute to get dental care, and it gets so bad, the pain's so bad that they have to go to the emergency room, and some of them have to get admitted to the hospital, and in some of my data I've actually seen death. And there's a big research now on non-traumatic dental conditions. People going into the hospital for things that could have been prevented in just a doctor's visit. And this is non-traumatic dental conditions are things like canaries, periodontal disease, and so forth. But the real point of this research is that these very high-cost non-traumatic disorders are completely preventable, and they can be diagnosed and treated in just one visit to the dentist, which is a lot cheaper. And so there is a need for policy change. Both dentists and physicians recognize that there is a need for policy change, particularly in Medicaid, which covers pregnant women and disabled people. And there's a recognition that there's a potential to reduce costs as well as improve health equity. And this is from my research where I found that in Texas, providing a simple, modest preventive dental benefit was very cost effective. $1 invested in this program to expand dental benefits for adults could lead to as much as $3.58 worth of savings. And the lady on the left is a health advocate and quadriplegic. She gave testimony in Texas about how difficult it was for her to find dental care without insurance and being a paraplegic. And What happened was that she wound up having to lose all of her teeth when she visited the dentist. But as a result of her testimony and some of my data, Texas passed a bill that provides dental care, preventive dental care for 450,000 disabled adults in Texas. So that's what my research is really about, delving into this whole issue of providing dental care and integrating dental with medical care. So I'll be looking at what happens in Texas. All they did was provide preventive dental, but I think that it creates the creative tension for comprehensive dental and better integrating dental care with medical care. Of course, it's a very complicated picture. What causes integration and what keeps these two systems separate, and that's what my research is about, and I'm focusing mostly on institutional factors associated with integration and separation. I'm also looking at the governor's proposed budget proposal, which actually includes comprehensive dental and TEN care for adults. So I'll always have a job. There's always new legislation that I can analyze. And finally, I'm going to be comparing systems across the globe. And some of them do better than we do, and actually we do better than a lot of people that you might be surprised about that. But I think that ultimately a new kind of system really wants to be born, and hopefully this research will help with that.